Thank you for joining us on this interactive segment. This evening we talk about COVID-19 vaccine. Have you been vaccinated? Is it partially or fully? Just know that by the 21st of December, you may not access in-person government services after the Minister of Health said that every person, every Kenyan citizen will be required to get vaccinated. So let's talk about vaccination drive and the role of county government, or let's say Department of Health in counties, and what they are doing to ensure that the government's plan to ensure that at least 10 million Kenyans are vaccinated before the end of this year, that target is achieved. Joining us this evening, we have Joseph Mbai, who is the CEC Health, the county government of Murang'a County. Murang'a, you're also the chair, the Kenya Chief Executive Committee members for Health, right?
Yes.
Welcome to this discussion. And we are talking about vaccination. We are seeing some counties vaccinating only 2%, while a county like Nairobi has vaccinated over 25%. Why is this so? Does it have anything to do with distribution of the doses that we have?
Thank you, Purity. My name is Joseph Mbai, the CC in charge of Health Murang'a County Government, and also the chair of the National CECMs Caucus. Actually, one of the main reasons why some counties are lagging behind is because of, number one, is because of their demographics. If you look at Nairobi, you realize that Nairobi has quite a sizable population. Yeah. And also, you look at a county like Isiolo, Lamu, you find that they don't have that very big population. So in terms of numbers, of course, Nairobi would be leading because they are leading in terms of the people who live in Nairobi. Yes. And then if you look at the proximity of the vaccine availability, they are able to access the vaccine faster than anyone else because first of all, the depot where the vaccine is kept is already in Nairobi. So they have all the advantages. Counties like Isiolo, Mandera, Wajir, Tana River, and Lamu, and Marsabit, yes, which are actually the ones that are lagging behind, will definitely face a few challenges, even of logistics, in terms of even taking the vaccine there. And you find that the Ministry of Health has also worked very well to make sure that vaccine is delivered in time, and they use air to deliver the vaccine. Okay. And bearing in mind that the vaccine comes with short expiry, and then it has some conditionalities that require it in terms of handling. You need to, it's a cold chain vaccine, which requires to maintain some certain degrees so that it remains effective and efficacious. So those are some of the reasons why you find some counties may be lagging behind. Because
I was asking that because a county like Mombasa, it's really lagging behind. Your county is ahead of Mombasa when it comes to vaccinating people. I think Murang'a County is in top 5 right now. So is it the role of the county government, and especially the offices of the Department of Health, that is, what is the role of the Department of Health actually in ensuring that people are fully vaccinated? Because we are seeing the numbers are not balancing as far as people who are eligible for receiving this dose is concerned.
Of course, it is a responsibility of each county government to make sure that their people are vaccinated. And if you look at what happened during Mashujaa Day, we had an acceleration of outreaches, making sure that we get out of the facilities and probably go out into the markets and the churches, just to increase the numbers of people who are getting vaccinated. But you see, this one now will vary from one county to another. You will find that, for example, for us in Murang'a County, the acceptability of the vaccine in terms of percentage is higher than probably counties like Mombasa and Northeastern and such. And we don't want to blame the health departments in those counties, because most likely it may not be them alone. It could be also the community themselves. When COVID vaccine came initially, there was a lot of lethargy in terms of acceptance. And you realize even some health workers were not even accepting it. But over the time, people have noted that it is necessary for everyone to get vaccinated.
Yes.
And when we had Delta variant, which was quite virulent, we realized that many people who actually succumbed to death were 98% not vaccinated. And a few of them who are vaccinated probably died because of other issues.
Yes.
But overall, if you look at anyone who had even the first dose or the second dose, and they got COVID during that Delta variant, they did not progress into serious disease. They never went to ventilation to get oxygen. They were able actually to manage and stay at home and go about their daily activities. But those who are not vaccinated and they had comorbidities like hypertension and diabetes, majority of them had serious disease progression and they were very sick, and most of them ended up in ventilation, and about 1.5% succumbed. So there is importance of getting the vaccine.
Okay. Yeah. And as of Monday, only 2.4 million Kenyans had fully been vaccinated. 6.4 million, 6 million, slightly above 6 million, 6.5 have received at least a dose, and the government hopes to vaccinate at least 10 million. Will this target be met before 31st of December?
We are working together with the Ministry of Health to make sure that we accelerate the vaccination, and we have development partners that are supporting the same. We had a meeting in Mombasa where we met all the CECs from the 47 counties, and we did plans, and we have activities now running right now towards achieving that target. And one of that is that to make sure that all the facilities that have been accredited as vaccination centers are running throughout the week. And then we were also given permission to do outreaches even in churches, in markets, and in some areas we are doing mobile vaccination units where you will find health workers moving with a van with the vaccine, vaccinating people even in homes, in markets, in even congregate setups like universities, prisons, schools, where, colleges where we have quite a number of students. But we have seen that when you go to colleges and universities, the uptick is still not very, very high. Yeah. But it's an activity we have planned as counties, and each county has been given a target. For example, for us in Murang'a, we've been given a target of vaccinating about 155,000 people. And each county has been given a target which they must achieve by the end of December. And we've been supported to make sure that that vaccination happens. Yeah. The only thing we want to ask the counties is to make sure that they follow it up and make sure that everyone who is in that space of vaccination is doing all the activities that have been planned. And then Ministry of Health is really supporting in terms of providing the vaccine. Right now we have Sinopharm, we have Johnson & Johnson, we have Moderna, we have Pfizer, we have AstraZeneca. So there is no way a person would say that the vaccine is not available. And with that availability, then the counties have no choice than to make sure that they vaccinate as many people as possible. Okay. Yeah. And the National Emergency Response Committee Chair, who happens to be the CS for Health, Mutahi Kagwe, has said that by December 21st, people will be denied government in-person services if they are not vaccinated. With that declaration, we are going to see a huge turnout of people who may need or to be vaccinated. So, and the minister has also said we only have 10 million doses available right now. How are counties going to ensure that everybody who wants to be vaccinated will get the jab? Of course, when the minister says that, in the back of his mind, he knows that as a government, we are committed to make sure that we protect Kenyans. And the Ministry of Health has actually ordered more than 10 million doses of Johnson & Johnson, which I'm sure will be coming in, although not maybe all of it, but gradually with time we'll have received the 12 million. And why the minister is saying that is because we've noted that there are some Kenyans who probably feel that the vaccine is not necessary. But again, as a government, we have a responsibility to protect our people and to make sure that we are the ones making sure that they don't get sick, because if they get sick and they come to the hospital, it will still be our responsibility to take care of them. And if you look at the cost of treating one COVID patient, Purity, you will find that it is very high. Yeah. And as a government, we would rather have to pay a cost of a vaccine other than paying a cost of a patient who has been hospitalized and the bill is running into millions of shillings. Mm-hmm. Of course, when the person has a vaccine, they will develop antibodies that will protect them, and eventually they can also get natural immunity. And people have a lot of myths around this COVID vaccine. But I think it is worth noting that once a person is injected with that vaccine, of course the body develops antibodies. And these antibodies will be able to protect you or whoever gets that vaccine when any variant of COVID-19 attacks them. Mm-hmm. And they will be safer with the vaccine than without. And more so the people who have other diseases like cancer, hypertension, diabetes, those are the ones that are at high risk. And those people who are now 50 years and above. And you can see the band has been increased, and the minister has even announced that you can vaccinate even from 18 years and above. WHO gave a directive the other day that even 12 years going down, we can still vaccinate. Yeah. So it is necessary, and as a government, we will not sit and wait for our people to be sick and then start incurring expenses treating them. We would rather put mechanisms and sanctions to make sure that people are vaccinated. Mm-hmm. Yes. And
when Kenya first received Pfizer and Johnson & Johnson, mm-hmm. the ministry said that it cannot distribute these doses to some counties due to issues to do with storage. They did not have the recommended storage for some of the doses. So what are your departments doing to ensure that also Kenyans in those areas benefit from these doses?
Well, as a ministry, yeah. we are aware of that, and COVID vaccines are all cold chain vaccines, and we don't want to waste them. Yeah. So when we say that a county has no capacity to handle a certain vaccine, we will not give them that one. We shall give them the one that we know they are able to handle, and the ones they have capacity to deal with. Mm-hmm. But again, the Ministry of Health is also building capacity in all the counties, and they are developing different cold rooms and cold chains in regions. So that, for example, for us in Murang'a, we know if we want to access our vaccine, we will come to Nairobi. Mm-hmm. The people in the coastal region, they know if they want to access their vaccine, they can go to Mombasa. Mm-hmm. The people in Nyanza region, they know if they want to access their vaccine, there is a cold room in Kisumu where they can access their vaccine. And government is actually building those capacities in different regions, just to make sure that all counties are covered and no one is left behind without vaccination. So there is no excuse. So no one is supposed to say that they cannot find the vaccine. Yeah. No one is supposed to say that the logistical support has not been given. The only thing we need to now probably emphasize is to create more awareness for people to come out in large numbers and get vaccinated. Yeah. Because if we vaccinate 60% of our population, especially all the adults and above 18 years, then we'll be safe as a nation. Mm-hmm. Yeah. And
currently our positivity rate for COVID-19 is 1.1%, which is a good thing. Yeah. But some of the European countries are already registering or witnessing a surge of the cases. What is the level of preparedness in the counties in case we experience another wave? And I'm talking about the US, for instance, is administering a booster dose to the citizens. I'm also talking about the capacity, bed capacity, in case we experience another surge, how prepared are counties?
Well, I want to say that counties are really prepared because we've had the first wave, the second wave, the third wave, and the fourth wave, and we've managed. And devolution is a good thing that happened to this nation. Yeah. If you look at what the counties are doing, Purity, you would be very amazed. County like Mandera, county like Wajir, the ones that were lagging behind in terms of healthcare systems, they have come up so well in devolution space. In Murang'a, we built an ICU in 21 days, which has 35 beds. Other counties have done the same. People have even employed staff for critical care. People have done a lot in terms of even isolation centers, in terms of ventilators, even oxygen plants and all that. So in terms of preparedness, I would say that we are not doing badly, because even when we had the Delta variant, we managed. You see, COVID has taught us the hard way that you can find yourself in Murang'a or in Kisumu or in Mandera, and you have nowhere to refer anybody. So each county is ready, because they know there can come a time when they'll have to deal with their COVID patients, and they will have nowhere to refer. Right. And that is the thing that COVID has taught us in the counties. So I want to say that as the chair of the CC Caucus, I'm aware that counties are really prepared, and even right now, more counties are putting in more isolation beds. They are putting in ICUs. You will find some counties have just opened their ICUs in just to be prepared for any other upsurge of COVID. And I want to say this, Purity.
Yes, as we
Kenyans must be very careful. We are not yet out of the woods. You can see now other waves are coming up in those Europe nations and China. So that means that we are not safe yet. We really need to continue wearing our masks, keeping physical and social distance, washing our hands, sanitizing, and probably making sure that we get vaccinated.
I think that's a right note to end the show. Thank you so much, Joseph Mbai, CEC for Health, Murang'a County, and also the National Chair, County Executive Committee members for Health. Thank you for your time. We do appreciate.
Welcome.
That's all the time we had for interactive segment this night. Cynthia Nyamai is coming up next with the day's business. Stay tuned.